warm welcome to you from Geneva, Switzerland. I'm Rida Sadki from the Geneva Learning Foundation. Very pleased to be here with you today. We did not schedule this. We're giving you a sneak preview of what we're calling our new Insights unit. We're going to explain what it is, introduce it for the first time ever with some amazing guests, starting with my colleagues, Charlotte Mbuh and Ian Steed. Charlotte and Ian, how are you?
Hi, Red. I'm fine, and warm welcome to everyone.
All right, let's see if we can get Charlotte up on the screen and Ian.
Hi everyone, this is Ian here. Really good to be here and excited as we share what we've been working on for the last month.
All right, so what's going on is that alumni from Pakistan and Nigeria recently organized a peer learning exchange to share early learning from COVID-19 vaccine introduction. So today, in a lightning chat format, we're going to discuss what insights were gained from this exchange with a very interesting set of people. Insights, so we call them Insights Partners. And today we have, first of all, Dr. Muhammed Imran Qureshi, who is a team leader for scholars and the COVID-19 Peer Hub in Pakistan. And then we have Jenny Sequeira. They're going to introduce themselves in a few seconds. Now, if you're attending this, you're going to be invited to join our new Insights page. And you can go to learning.foundation/insights. That's insight with an S. And you will find a lot more information. So I'm not going to go into it. What is the Insights unit and so on? You can go to learning.foundation/insights and find that out. You'll understand to get a better feel for what and why and how we are doing this. And you can also become a member or just request more information, put in your name and then your email. So that's and then you'll receive additional information, including the summary briefs that my colleague Ian Steed, working with Charlotte Mbuh, have produced to summarize what happened during those peer learning exchanges, what are the takeaways and insights. And then the complete recorded sessions of this really fascinating peer learning exchange. It's several hours of sharing of experience, of describing the situation, analyzing the situation. That is going to be live streamed right after this lightning chat. I'm now going to hand it over to Charlotte Mbuh, who I believe has a lot of questions for us. Charlotte?
Yeah, thank you very much, Reda. And yes, I have a lot of questions to ask our guests today, but I'll be starting with you, Reda. Why did the foundation have to start an Insights unit, and what does it do?
So since 2016, I'll give you a short answer. Since 2016, we've been supporting people who deliver vaccines in countries, working with partners. And over time, this has grown into the fastest growing, largest platform of national and subnational immunization managers, driven by really the opt-in, the motivation of people who created and are sustaining this platform. People on the platform are experts in their local reality. They understand better than anyone else, anyone who's not there, possibly can. And we realize that there's a lot to be gained by listening. And we realized we do this in our courses, we do this in our programs, but we also thought we could do this in a different way. One, to give back to our core community, to the community that is generating these ideas, this enthusiasm, this action, and these outcomes. And at the same time, we thought that all of this learning, this continuous learning, could also be shared with regional and global partners, especially at a time when Immunization Agenda is calling for renewed listening, renewed attention to people who deliver vaccines in countries.
And thank you very much. Reda, talking about people delivering vaccines in countries, people making a difference as far as immunization is concerned. Last month, that is on the 12th and the 19th of June, we have a scholar alumni from our COVID-19 Peer Hub from Nigeria and Pakistan, the self-organized inter-country rapid learning experience sharing event around COVID-19 vaccine introduction. And today we are pleased to have a distinguished team leader of scholar alumni from Pakistan with us, Dr. Muhammed Imran Qureshi. My next question is going to be for him. So warm welcome to you, Dr. Muhammed Imran Qureshi. Before we go forward, please can you kindly introduce yourself?
Thank you very much, Charlotte. And it's Dr. Muhammed Imran Qureshi. I'm basically a medical doctor, and I'm working in immunization program for the last more than a decade. Started my immunization journey, the professional journey in polio program. As you know, the Pakistan country is struggling for polio eradication, and then opted for PI signers, a platform to switch towards API. And finally, I'm working in EPI since last 2016. So the amazing journey of Scholar platform at the Geneva Learning Foundation is continued, I believe, from 2017. And I did not recall if I ever missed any Scholar course. And I'm thoroughly enjoying. And I believe this platform has transformed me into a more mature immunization professional, and I'm supporting my organization and my program in a better way. Thank you very much for this exciting.
Thank you very much, Muhammed Imran. So my question for you is, how did Pakistani and Nigerian immunization professionals meet? And why did they decide to share their experience of COVID-19 vaccine introduction?
Thank you very much, Charlotte. Since COVID-19 pandemic started, countries are struggling to fight against the COVID pandemic. And the surveillance is going on. At the same time, the COVID vaccination drive is continued. So what actually came as an insight from the country Pakistan, that we should share experience and we should learn more about COVID-19 vaccination drive, how people are responding to it, and how other countries are like working under this platform, and what lesson we can learn from each other, and how we can improve our vaccination drive in a better way with collateral experience sharing. So the idea was, since Pakistan is just in the neighbor of India, who was having a tough time in the fight against COVID-19. So basically, we thought that if we could have a conversation with Indian scholars and could see and tell them what is going on between the two countries regarding the COVID vaccination response. So actually, there was a little bit fear in Pakistan, since across the border, the situation was not too good. And in Pakistan also, the COVID vaccination has been started. So basically, the idea was to share some experience. But meanwhile, we always closely resemble to another country, Nigeria. So Nigeria, in many respects, is pretty similar to Pakistan. So we were quite happy and wanted to explore vaccination drive experience going on in Nigeria. So we wish to have, and we are thankful to the Geneva Learning Foundation. They provided us this opportunity that we can talk to each other and can have a profound experience sharing, which is definitely beneficial for both of us. Over.
Thank you very much, Dr. Muhammed Imran Qureshi.
Thank you, Charlotte and Imran. Yeah, we have to mark a pause because there are some wonderful people. We've been talking about this platform of immunization professionals. So want to acknowledge Flor Mondeg. I believe she's connecting from Haiti. Is that Amel?
Yes, from Haiti.
El Tahir, who sends her greetings for Eid to all those who are celebrating, connecting from the Kingdom of Saudi Arabia. Our very own beloved Martha Ngoe, team leader for the Cameroon alumni, and Mercy Onu Peters from Nigeria. And Mercy, I'd like to ask you, we did not announce this. This is a sneak preview of something we've been working on for several months, and I know you were involved in the exchange. Please share with your friends right now, your colleagues, if you have time and if you think it's worth listening to, just reach out to them, bring them into the live stream. They're welcome to join or watch and catch up afterwards. Valerie Oben from Cameroon, Kwada Asundua Shagwa. Kwada, you haven't told us where you're from, or where you're connecting from. Aminu Yahaya Ibrahim from Nigeria. And then Amel says she considers herself truly blessed to gain a lot of experience since the COVID-19 pandemic has started till now. And she says credit goes to TGLF, but I would say there is no platform without the people who make it. Back to you, Charlotte.
Thank you so much, Reda. So I'd like to recognize Alan Brooks and Jenny Sequeira that have joined us here in the room. So my next question is going to be for them. And I'll start with you, Alan. Please, you'll start by introducing yourself. But both you, Alan and Jenny, you've worked in global health. Alan, you were senior manager at Gavi, overseeing global programs that support countries. Jenny, you worked with in BMGF's Nigeria program. So what if knowledge and learning does not flow between people who deliver vaccines? What's the point here? So I'm going to start with you, Jenny. Please start by introducing yourself, and then we'll continue with Alan. Ladies first.
Thank you, and hello, everyone. I'm Jenny Sequeira, and I've worked in immunization for over 20 years, most recently with the Gates Foundation, supporting the routine immunization and demand portfolios in Nigeria. So just a shout out to all the Nigeria colleagues who've joined. I think that what's the point? Great question. The so what is always the hanging question. We just finished the decade of vaccines, which was really about introduction of new vaccines and top-down sort of scaling up of all these new vaccines across many, many countries. And now we're entering Immunization Agenda 2030, which to me is about the decade of vaccination. And vaccination is a process. It's really about the hows, not the whats. It's not about the manual that comes from the top-down level, but it's bottom-up. How are health workers learning from each other? How are they sharing particulars? You can't improve a system with generic information. You have to have particulars. And so I think that's exactly what these exchanges provide. It's not just we did this, not a laundry list, but it's the particulars of Nigeria being able to ask Pakistan, how did you use your digital health platform? Or how did you address AEFI? It's about Pakistan asking Nigeria, how are you using your polio assets to maximize vaccinating adult populations, which are not what we're used to in routine immunization so much. So it's really the so what to me is about being able to have direct communication of health workers to health workers across different systems and countries, which would never happen without a digital platform opportunity. So it's really that gold in sharing the process and the how. And I think as we get more and more into this decade of vaccination, the process part will become more and more important.
Just as a reminder to recap for those of you who are just joining us, 12th and 19th of June, something happened that was exceptional. Teams of alumni from the COVID-19 Peer Hub, members of the Peer Hub from 2 countries that are geographically quite distant, but that also share some commonalities, came together. So the teams from Nigeria and Pakistan met twice and had an exchange sharing their early learning from COVID-19 vaccine introduction. Now over to Alan Brooks to answer Charlotte's question.
Thanks, Red. I really appreciate the chance, and Charlotte, the chance to chime in. I want to start by introducing myself. Alan Brooks. I'm the co-founder of a nonprofit organization called Bridges to Development. Before that, I was responsible for a number of roles in Gavi, in the Gavi Secretariat, including for a period of time the health systems and immunization strengthening. And when an entity like Gavi, or an entity like Bridges to Development, or even WHO or UNICEF is looking around the world, the opportunity to learn and listen to folks in Pakistan and Nigeria is what I took away from this, that this is an opportunity. And so I want to really congratulate and thank the 2 teams for their thoughtfulness in sharing the lessons with each other, but also with those of us who are working to support them outside of their countries. Because you are actually helping us understand what we can do better to be better partners for you, better resources, better contributors to your work. One of the things we've learned is, as Jenny said, from the decade of vaccines, but also from COVID so clearly, is that the solutions are not cookie cutter, are not one size fits all. And as Jenny said, that reach, that extension of services to the last pieces of the chain through to the last communities is something that is absolutely about building on the local knowledge, building on the insights that individuals and communities have. And that's what I was seeing and hearing. in the discussions were how the two teams were really tailoring and thinking through the opportunities and challenges. So I found it an incredibly rich opportunity to learn. And so thank you for that. And I think that I heard just the value that the two teams also were placing in it, and so that is, I think, another value that certainly is an opportunity to take forward. So this path that is being charted by the two teams is something that is, I think, going to have a profound impact on how immunization services can continue to improve over the years to come. So congratulations, and I really look forward to learning even more and hearing even more as you learn from each other as well. Back to you, Charlotte.
Thank you very much, Alan. Right now, I would like to turn towards Ian Steed, my colleague and also editor of the Double Loop. So, Ian, if I were to subscribe for the Double Loop, what will I receive in my inbox? So can you tell us a little bit about the content of this package that you're proposing from today?
Thank you, Charlotte. And I think, first of all, we should be clear what you won't receive if you subscribe to the Double Loop. We're not proposing a weekly email. We are looking out for interesting, exciting pieces that we can package for you based on what people from across the network of immunization practitioners that we engage with, what they are saying, what they are doing. It won't be regular. It might take different formats from week to week. It certainly won't be country exchanges every week. But what we're trying to get down to is what Alan and Jenny have described so well, really. We're not looking for the cookie cutters. We're not looking for the generic pieces of information. We're looking for those particulars that people are sharing. And I think you should be signing up for this if you're looking to hear from your peers, from other countries, from other contexts, and just looking for that source of inspiration or that aha moment in a short email each week that maybe just helps you do what you're doing that little bit better, or changes perhaps a mindset or a way of thinking about something that allows you to do your work better. So that's what we're aiming to do.
Thank you very much, Ian. And now let's look a little bit at the key takeaways from the Pakistan-Nigeria early lessons on COVID-19 vaccine introduction. While you prepared the current issues of the Double Loop, what key takeaway, what surprised you from the Pakistani presentation that they shared with their Nigerian colleagues on the 12th of June?
Well, I mean, there's, again, you make it sound really easy, but we're talking about an hour and a half of discussion, of questions, of people responding. So synthesizing this down is felt like a bit of a mammoth task, and I'm really grateful to Alan, Jenny, and yourself, Charlotte, and the other people who have contributed to this. One of the things that struck me as part of this conversation was at a time where I've been hearing a lot about vaccine hesitancy amongst health workers. It was a description of how in Pakistan vaccine hesitancy amongst health workers was being addressed through sharing data on COVID rates amongst health workers, comparing those who had been vaccinated with those who hadn't been vaccinated. So that was just something that struck me among a number of interesting points, I must add.
Okay, I would like to turn towards Jenny and Alan again, just to ask you, while you reviewed the full insights brief based on Pakistan and Nigeria's team sharing, what did you learn? Just one thing that actually surprised you, if I could use the word again, about their experience with COVID-19 vaccine introduction. So start with you, Alan, and then Jenny.
Sure. So I actually, it really struck me how across the two there were really dedicated and specific efforts to increase the so-called accountability. And I was actually really pleased to see that word coming up so strongly, because accountability when it comes to immunization is very different from any other type of health intervention. Because I'm not only accountable for protecting myself, I'm accountable for protecting my neighbor. And the person, the healthcare worker that is accountable for helping me protect my neighbor, that chain is absolutely critical. And so seeing the accountability for that chain, for those connections, for protecting not only ourselves, but our system and our communities so clearly come out is fabulous. Because once you have that demand, that accountability, that's where you start to see change. That's where you start to see coverage. So really, congratulations to the team for that focus and emphasis.
Okay, and you, Jenny?
Yeah, so a couple of things struck me. One was how large the vaccine hesitancy featured in both countries. It's not surprising, but I think the issue with health workers being hesitant is something that a lot of the conversation was focused on, and trying to unpack what does hesitancy mean, because a lot of times it can do more to do with the vaccination process and less to do with the vaccine itself. And so trying to unpack some of those things was useful. But also both countries have had years of polio vaccination campaigns. And so the eradication efforts in both countries were useful, and both countries highlighted how they've used their polio assets, so to speak, to help with the strengthening the COVID vaccine introduction. I wish that, as we look more at how to address epidemics, pandemics, the polio assets issue comes up more, because polio eradication right now is about eradication of the wild virus. It's not about eradication of the disease. And so if you look at how polio could improve strengthening the surveillance and the ability for countries to react to epidemics or to strengthen routine immunization, I think more of a focus on the disease itself and how to really look at vaccine preventable diseases holistically would be even more helpful. So just a little bit of a challenge to the Global Polio Eradication Initiative because of how it's showing itself to be useful for things like pandemics.
Thank you very much, Jenny.
All right, thank you all. Before we hear from Pakistani team leader of the COVID-19 Peer Hub, Dr. Muhammed Imran Qureshi, we have some more folks who've joined and said hello. Please do ask your questions. This is a sneak preview. We did not announce this. We're sharing with you for the very first time some of the work of our Insights unit based on the amazing exchange between two country teams of the COVID-19 Peer Hub. So I want to acknowledge Joseph Fisbodo, probablement un francophone depuis la République démocratique du Congo. From South Africa, as Fundo Gratitude, welcome to you. And then we do have Nigerians joining. So Emanuela Chi Odunze, greetings to you. Minkop from Nigeria as well. Tell us where in Nigeria, where we feel like we know yes, the different, there are different states, different cities. Let us know. Mercy Onu Peters, who thanks us for, and thank you, Mercy, for bringing us together from all over the world to meet, learn in a shared experience in this platform on immunization. Okay, we have Team Pakistan. So Dr. Taimur Kayani, who's joined, Ashraf Ali Lako, also from Pakistan, who says it's a great platform for learning. We need you to tell us why and how. What are you doing with what you're learning? Is ultimately at the end of the day, that is the so what, to speak to Jenny's question. And as Fundo says, very formative insight on the double loop. That's what we hope. And then Rebecca Bello says she's glad to follow the discussion, and she's connecting from Abuja, Nigeria. So if you want to know more, we're going to give you, if you want to know what happened during the exchanges, you have to go to learning.foundation. This is the page I'm on now. Let me see if I can point to it. Yeah, here. And you go to learning.foundation/insights. The page is not public yet. So if you're here on this sneak preview, you can already go and click on learn more and subscribe. Back to you, Charlotte.
Thank you so much, Reda. So I'd like to turn now towards Dr. Muhammed Imran Qureshi, once again, team leader for Pakistani COVID-19 Peer Hub members. So, Dr. Imran, what did you gain? Can you tell us what you gained from this peer learning exchange? You know, some people are going to ask, and I'm going to still reiterate what Reda and Jenny said earlier. I say, what? So what? So what did you gain from there? You know, over to you.
Thank you, Charlotte. You know, there was a lot to gain regarding this collateral experience sharing. First of all, honest to God, we were amazed to see the Nigerian scholars experience sharing. The overall planning was superb, I believe. And we were discussing among our scholars in the country that such a beautiful way they just planned this COVID vaccination drive. They considered each and every aspect of the vaccination drive, right from the vaccine demand, and then dealing with the AEFI, formation of the teams, tackling with all the myths and rumors, and the robust communication strategies to address and to reach to the people for COVID vaccination. So it's just amazing. And we got a lot of insight from each and every aspect. For example, if I can just quote one very specific thing, like, you know, we were just discussing about the vaccine hesitancy. And, you know, once you start the mass vaccination drive, COVID probably is the biggest. And this COVID vaccination, mass vaccination drive, there are a lot of challenges to be addressed. And those challenges arise time to time. So this vaccine hesitancy, apart from other challenges, is really, really important. So if I can quote you from Pakistan, Pakistan reached first 10 million vaccinations in 126 days. But, you know, they capitalized the experience sharing and the lessons learned, and they kept on improving. And the next 10 million vaccinations were reached in only 32 days. So you can see the progress. And this can happen when we come across, we share experience, and we continue improving. So that is what we gained from Nigerian scholars. Over.
Thank you very much, Dr. Muhammed Imran Qureshi. Just before you go, I would like to ask you this question. Can you remember, I know we received the presentation for Pakistan was done by Dr. Sophia Yunus, a deputy director for EPI in Pakistan. And during her presentation, it was very elaborate. I want to ask you, do you remember Nigerians' colleagues being surprised by any particular point? I am sure there are some people that have even contacted you in private about the Pakistani presentation and their experience with COVID-19 vaccine introduction. So can you share any of that with us?
Thank you, Charlotte. Yes, you're right. A lot of scholars from Nigeria, they were like privately sharing many messages. They were like busy in talking to us and elaborating more and more. Not just the proper platform to share the experience. You know, the platform provides us the connectivity, and from there on, we are together, we are connected and using a lot of channels to interact with each other. So the same happened, and we experienced a lot of stuff, and a lot of things improved after this collateral sharing. What I actually understand, the most important thing which I recall, basically we have a centralized, you could say, the coordination channel in Pakistan, which was established fairly early during this COVID vaccination drive. We call NCOC, National Command and Control Center, to monitor this COVID-19 vaccination drive and its other activities. So this single platform helped us in many ways, and a lot of like technologies were developed, a lot of new initiatives were taken to incorporate and to ask people to continue following SOPs. And then the same platform not just helped us in surveillance, but also helped us in vaccination drive. So the use of technology, I believe, was the most important aspect of this vaccination drive and surveillance, which was clearly asked again and again by the scholars. And we shared a lot of experience sharing and a lot of success stories which we took from Pakistan and shared with the Nigerian scholars. Over.
Thank you, Muhammed.
Thank you all. That will be it. This was a 30-minute lightning chat. We're right on time, but let me tell you a little bit more. If you're we did not announce this. This is really a sneak preview of something new that we're doing at the Geneva Learning Foundation in partnership with great partners like Bridges to Development and IVAC from Johns Hopkins School of Public Health, the International Vaccine Access Center. This is about surfacing new kinds of insights. We recognize increasingly in the global community just how important local action is to achieving these global immunization goals. We need fresh insights to support those leading change in districts, health facilities, communities. So this is about the new Insights Unit, the Foundation's research and analysis group. We collect thousands of data points, and because you're here, because you're following us so closely, so attentively on social media, you can now go to learning.foundation/insights. You can see and you can learn more, read more about what we're doing. This is also about the Geneva Learning Foundation's commitment to giving back. You are an amazing immunization community. You're doing amazing things every day, connecting to a global network. On top of your daily work, we want to give back and share these insights and share them with bring them to the attention of regional and global partners. That's it for today. Thank you for following. We have a lot more going on, as you know. On Monday we have a major event. Charlotte, do you want to say a little bit more about that before we go? What's going on Monday at the Geneva Learning Foundation and across all our platforms?
Okay, so a year ago, in the face of the COVID-19 pandemic, thousands of immunization professionals from around the globe who were part of the Scholar platform, the Geneva Learning Foundation programs, came together to look for ways to ensure continuity of immunization services and to face and to overcome challenges that they were facing in terms of vaccine delivery because of the pandemic, and created what we call the COVID-19 Peer Hub. So today, 1 year later, we want to look at the next step. Last year, we were able to do 2 exercises, one on action planning to respond to challenges in immunization due to the COVID-19 pandemic, and the second was on case studies on vaccine hesitancy. So join us on Monday. I'm not going to unwrap the package, but one thing I know is that we have immunization that 2030. That is what global partners have put together with ministries of health as far as vaccination is concerned, immunization is concerned over the next decade. So join us on Monday to discover all that which we have prepared for you, our community, together to see how we are going to move forward as far as immunization is concerned. But I don't feel like unwrapping the package just yet.
Join us Monday. You can find the information on the Geneva Learning Foundation social media platforms. Learn a lot more by going to our website and follow us wherever you are. If you're more comfortable on Facebook, follow us there. If you're more comfortable on LinkedIn, and connect. In September, we'll be having a networking event when you can network and meet other professionals. Thank you once again, and see you soon.